A patient with a very severe headache that's non-responsive to over-the-counter pain medications and have a history of some cyanotic congenital heart disease like tetralogy of Fallot, start thinking about a possible brain abscess that has spread hematogously. Along with the headache, of course, you can have vomiting, particularly in the early mornings, and this is a sign of increased intracranial pressure. On top of that, because it's an abscess with bacteria, expect some fever or even focal neurological changes because it could be pressing on certain areas of the motor cortex. You can have leg weakness or hyperreflexia, and sometimes, if in the right area, you can have patients presenting with seizures. The best thing to do is to get brain imaging when a patient like this comes in. Bacterial meningitis should also be on your differential, but remember that nuchal rigidity is normally found on examination. Focal symptoms, such as the one that I explained, like weakness or hyperreflexia, makes brain abscess a lot more likely. Now, let's say if the patient is absolutely normal, but they are presenting with some seizures, don't forget to also check labs. At this point, we're not thinking about brain abscess, but you can start thinking about some electrolyte imbalances. This can range from severe hypocalcemia to hypoglycemia or hyponatremia. And if you have hypoglycemia with seizures and we're still thinking of something congenital as the primary cause, don't forget about DeGeorge syndrome. If you're thinking about a pediatric tumor, medulloblastoma is probably the one that's going to present with nocturnal or morning headache and vomiting. But remember, it likes to press against the cerebellum, so it causes incoordination and ataxia. And the patients with pediatric tumors won't present with fever or anything that seems to be of bacterial origin.